Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, Basanti, 45-year-old woman, presented with hot flushes after stopping menstruation. Hot flushes are relieved by administration of the following. Hot flushes are relieved by administration of ethinyl estradiol. So, hot flushes are relieved by administration of ethinyl estradiol. Then, all of the following appear to decrease the hot flushes in menopausal women except androgens, isoflurane, and tibolone will decrease the hot flushes in menopausal women, but raloxifene it will not decrease the hot flushes or leg cramps. Rather, it increases the hot flushes and it also increases the leg cramps. Then, the absolute contraindication of hormone replacement therapy is thrombosis.
thank you and thank you for watching.